Welcome back. Now, the Western Cape remains the epicenter of the coronavirus outbreak in South Africa, and it is currently recording the highest number of infections and deaths. Premier Alan Winde yesterday gave a media update on the province's breakdown, and community transmission, we understand, is well established, and the numbers are expected to increase as the virus continues to spread. Premier Alan Winde joins us now. Thanks so much and welcome to Morning Live.
Good morning. Thank you very much. Good.
Premier Winde, let's just start by taking a look at the latest numbers of COVID-19 infections and deaths in the Western Cape. Yesterday, earlier in the day, you said 4,049 infections, 76 deaths. However, later on, the Health Minister, Dr. Zweli Mkhize, said 3,994 infections and 79 deaths. So how are these numbers calculated and how are they communicated to the National Department?
Okay, so we finish at 1 o'clock and we update our dashboard. Our live dashboard gets updated every day at the same time. And of course, that's the numbers that we base it on. But we send those numbers also up to the national. And I mean, sometimes there's that couple of hours correlation difference. But, you know, every single day it gets corrected and updated. So that's slight a little bit out, but I mean, that's just the time of the day in which you send your results in and when we update our dashboard.
So which would be the correct numbers to reflect on right now?
Well, I mean, as of 1 o'clock yesterday, we were on 4,049. Depending on how many tests we got through the system, we'll probably be on 4,200 or something like that. So, you know, I don't have that data, but at 1 o'clock we'll push the button and that will be the data that we'll have that we'll update our dashboard on. You know, it changes every minute. We're doing 4,000 tests a day and more.
So what are your main concerns at this point, Premier Winde, when it comes to the speed at which the infections are spreading in the Western Cape?
So, I mean, obviously we know what we know about the numbers of cases because of the way that we're testing. So we do two kinds of testing. The one is the tracing and testing where you go in, we're on 300,000 tracings where you get asked a range of questions. It takes about 5 minutes. And out of those questions, we then refer you to be tested or not. And out of that process, we probably sitting close to 10,000 of our tests came through that 300,000. But we also do another round of tests where we actually, when we pick up a positive, it could be in a clinic, it could be in a police station, it could be in a shop, wherever it is, we would go in and then we would test everyone around that person, called tracing, tracking, and then testing. And that obviously gives us a much higher result. We're getting probably close to 7% positives to tests when we focus and then zoom. And now that it is not so much an imported virus, it is actually transmission that happens in communities. We are also zooming into those communities. So we would be doing more testing in our hotspot areas in the city of Cape Town or perhaps out in Witzenberg because we know that those are more of a hotspot. So they will obviously get much more testing focus versus perhaps out in the central Karoo, which at the moment we don't have one case yet.
So speaking to the hotspots, you mentioned Witzenberg. Which are the other hotspots in Cape Town?
So we've got 9 altogether regions, and if you zoom in on our dashboard, you can go in and see them. I actually want to go down more granular in the next short while down to ward level, so people can even see in their ward the kind of infection rate. But at the moment, if you had to say which are the biggest hotspots, I would say in Khayelitsha we've got a big hotspot, in Dunoon, in the Tygerberg area, and then I said out in Witzenberg. Although I'm seeing a little bit of slowing in Witzenberg, but you know, these things are erratic. It doesn't, you know, maybe we're testing in the wrong place, and hopefully we actually are slowing it down. So you know, that's the nature of the beast. The more you test, the more you're going to find. And in actual fact, if I look at the world standard, now if we're in our hotspots and we're getting 7% positive, it actually tells us that we should increase our testing, probably double our testing rate, and we're doubling our numbers, our infection numbers around every 8 days. But our specialists are telling us that that everything's on track. It was what we were predicting from the beginning. It sounds like our peak is coming in June, July, and we are tracking. We had 80 specialists called by Minister Norma French Mbomba, our MEC of Health, a day before yesterday, to analyze our death rate. And they've come back. Our death rate has actually dropped slightly. We were at 2%. It's now 1.8%. And obviously we've got to rely on this kind of analysis, some really serious professionals. And the world norm is around about 1,000 deaths per million. And they say we kind of on track. Obviously for us, the big risk are people that are at risk, which is either the elderly or people with the comorbidity, so hypertension or diabetes, and we've got to make sure that those are the people that are protected because they are the most vulnerable.
If we look at those profiles in terms of communities and what your health statistics would be telling you in terms of comorbidities and their existence already in the profiles of community members, what are some of the behaviors that you are most concerned about and that you have noted in places such as Khayelitsha and Mitchell's Plain, where the numbers have shown a spike?
So, I'll just use yesterday as an example. What's happening is when you get social grant payment days like we are having at the moment, and then on top of that you might find some retail outlets having to close down to do deep cleansing because they've picked up a positive case, and we've got quite strict protocols, and we've been meeting with businesses quite regularly, from a spaza shop to a big retailer, or it could be a factory or an agri-processing plant, to put the right protocols in place, deep cleaning, the right protection, spacing, etc., and management of your work environment or your retail environment. But when you do get a positive case at the moment, you close it down. So in Khayelitsha yesterday, a number of retailers were closed down to do deep cleansing, and at the same time it's social grants, and everyone wants to congregate around a few ATMs. And really that became very difficult. We had to, we picked it up. We had to very quickly get in and make sure that social distancing was in place, trying to help people to understand the risk when we do congregate in such big groupings. And whether it's there or as we saw on the promenade, when the lockdown opened up and many people congregated around an exercise time, again, we had to make sure we had extra law enforcement. We had to really get in there to make sure we're keeping the social distancing and the hygiene protocols, which are how we mitigate the spread as best as possible while we're preparing the health response.
So you note that you've had to bring in law enforcement to try and mitigate against, the easing of lockdown restrictions. As you say, on the first day of level 4 of that lockdown, we saw those visuals. We crossed to our reporter, Craig Murray, and we saw the runners, the walkers going out in their numbers, and social distancing was not necessarily recognized or adhered to. But since then, have those patterns, exercise patterns and otherwise, changed in any way? And I ask this, Premier, because there are those who believe that given that Cape Town and the Western Cape is the epicentre, it would seem right now, of the coronavirus outbreak in South Africa, that perhaps Cape Town needs to wait before they start opening up the economy. But what's your view on that as well?
So obviously, the number one, I think specifically as people came out of a 5-week lockdown, I think people automatically, you saw all over the place, people wanted to just get out. We were saying, please just don't go crazy. The data and the stats that we're dealing with right now are the numbers that come out of level 5. We will still see probably in the next week or so if there's been a massive difference in infections because we're moving to another level, number one. But number two, the whole reason for lockdown and the whole reason for masks and social distancing is to actually slow the spread and to make sure we flatten the curve so that our health department can deal with the peak in which our epidemiologists and specialists are telling when our peak is going to be at. I know that in South Africa, we're saying the peak is going to be sort of August, September. We are expecting our peak in the Western Cape to be more June, July. And so are we able to cope? So we've finished now the rollout of our triage and testing centres across the country. We let know, we put that out yesterday as well, where all of those are. We're busy building the biggest COVID-19 focused hospital, where there's going to be 850 beds in the CTRCC. We're busy doing 2 more contracts in the city of Cape Town, and we're looking at a contract now out towards the Winelands for these extra hospital beds. Our peak says we need about 1,000 beds. We're putting 1,400 extra beds in high care. Our other pressure is the 750 beds shortfall at the peak of ICU beds. That's a different issue of how to get those beds in place. We don't think we're going to get them, the 750. That's our shortfall. We're making up the other high care, but also I think as science is changing, as medicine is changing, we are trying new ways, and we've found that high pressure oxygen seems to be helping quite a lot better. We're doing rotation of patients. That also seems to be helping. And so, we're learning all the time. We're learning from other parts of the world. And, of course, our own doctors are busy trying new things, doing different things so that we can cope. And I think our medical answers will be, or our readiness. We've doubled our PPE stocks. We were at 48 million. We're now at 102 million rands of the PPE stocks. So it's really, we're using the lockdown to get ready. And then you've got to balance the lockdown versus the economy, because it doesn't help if we're losing thousands and thousands of jobs. So, of course, when your health response is ready, then you must be able to open up your economy.
Even with community transmissions well established at this point, you think that's a risk worth taking, Premier Winde?
Correct. You've got to make sure you're getting the balance right. If you don't get the balance right, well, then what's going to happen is the missing middle ends up starving to death instead of getting COVID-19. Also, you've got to analyze your risks, and you've got to create that balance. I think we really are putting a lot of effort into the health response. We know already 90% of the cases at the moment are not needing medical care in our hospitals. They're getting tested and actually managing to deal with the virus at home. Many not even showing the symptoms. They're asymptomatic, but of course some are treating it like a common cold or a flu. And then 10% are needing our healthcare systems at the moment, and we're finding that of the 10% that are then coming to our healthcare systems, 82% are then coming through with our healthcare and then going home again. So, of course, it's about that balance.
Well, we'll leave it there for now. Thanks so much for your time this morning. Alan Winde is the Western Cape Premier, giving us an update on COVID-19 in his province.